Thank you, Dan. I'm happy to report that we are going full steam ahead. We have received vaccine as of yesterday after a week long of delays due to the weather and not getting vaccine. We weren't the only county. There were many other counties in the state that were challenged with the same thing and had to cancel clinics. So we're back on track, and all of this week we have our second shots clinics for people 65 and over who came through a month ago, and there were appointments were rescheduled for this week and some for the following week. And I want to reassure everybody that as long as you get your second shot within 6 weeks of the first dose, we're being told that the efficacy is just as good. So you don't need to worry about that, and we will be able to get everybody in. Unfortunately, some people may have not been able to make their rescheduled appointments, but for the most part, they are, and we're trying to squeeze them in where we can. But we ask everybody to keep the same appointment that they had on the same at the same time for the rescheduled date, and they should have received an email and or a text message. So we have clinics starting yesterday. We are on clinic number 11 today.
Wow.
And we've vaccinated 1,617 people. As of yesterday, we're getting through an average of 150 to 200 people a day. And starting next week, we will be scheduling our clinics at SUNY Sullivan and testing out our expanded staffing plan with our volunteers to scale up and to start ordering more vaccine. So we received a total of 1,600 vaccines this week. Some of that was owed to us from canceled clinics, and some of it is new. So what we've done is we have worked very closely with our healthcare partners. We've gotten permission to redistribute some of that vaccine in small amounts to the hospital and to Sun River, which is our federally qualified health center. And we're working with them closely to make sure that they have an adequate amount of vaccine to continue their clinics as well. So they're continuing to work through essential workers in 1A and 1B and people with comorbidities at Garnet. And they are going to be working through people with comorbidities at Sun River. So that should get a lot more people in sooner. And again, their demand far exceeds the supply right now. So just continue to try their websites for registration information, and we have that information on our webpage as well. We're continuing to partner with them as well as with the Center for Discovery for using vaccinators and student nurses with SUNY Sullivan. That's going to be something we're doing. And we have a lot of volunteers, over 100 that have signed up through Serve New York. We're going through the training and vetting process right now. Many of those folks have already received communication via email from our volunteer coordinator, Linda Squires, and should be getting additional information very soon. Please keep in mind that if you don't hear from us, it's not that we have forgotten about you, it's that we're working through the vetting process and bringing people on board, maybe 10, 20 at a time. And it depends on when they're available. And most of our clinics, if not all of them so far, have been during the weekday and during the work day. So when we get to the point where we're able to have our volunteer corps pretty much stand alone with just a few of our staff, then we'll probably consider doing a Saturday or a couple of evenings here and there to better accommodate both volunteers and the public. But we're very busy. We have scheduled clinics through the end of next week with the vaccine that we have.
And of course, I think the big question on a lot of viewers' minds will be, well, how can I sign up to get that vaccine?
So unless we get additional vaccine from the state that tells us we can use it for 65 and older. And we might, that might change. We're not planning on doing that additional group. However, most people 65 and older will have some sort of comorbidity health condition. So that's another way they can get through. And they can also keep checking with the pharmacies, because the pharmacies will continue to get vaccine as well. We're going to provide an updated list week by week when we become aware of which pharmacies are continuing to get vaccine. Right now, that is the Medicine Shop in Liberty, the ShopRite in Monticello, the Riverside Remedies in Callicoon, and there may be some other ones coming online fairly soon. So that's another resource. I think as the pipeline of vaccine supply starts to open up and get better in the next few weeks and months, we're going to see bigger clinics for public health that we'll be doing. We'll also probably see our healthcare providers start receiving vaccine, hopefully very soon, directly from the state so that they can start vaccinating their patients.
Good. So our upcoming clinics, well, what populations will we be serving?
So right now we're working through our second dose clinics for the 65 and older. Those are the next 4 clinics. Once we get through those, we're going to be offering on Thursday of next week a clinic for essential workers. And please keep in mind that we're given specific instructions when we receive the vaccine in a separate letter, what groups we can vaccinate. I'm hoping that that starts to get more relaxed. We will be able to vaccinate people with comorbidities, but we still have to make essential workers in category 1B a priority. And we're still working through that group. It's a pretty large group, and we have about 1,000 people left to go.
Wow.
So those are people like firefighters, police, teachers, school personnel. We can include people who are paid drivers of buses and transportation and that sort of thing. Anybody that's on the list for 1B, and you'll find that on our website.
Now, we've been reaching out, though, directly to these essential workers. There's not a place that we're saying they should go to sign up. We're going to reach out to them usually through their employers or their agency that they work with, right?
That's right. And I think that's why people are confused. How come we haven't posted public links? Since the very beginning when we did that one time for the 65 and older, and it filled up in 2 hours. So because the links they're meant specifically for people that we know are eligible. So we work with a point person or two, an employer or a designated official who knows the contact information for their group, whether it's firefighters or law enforcement or teachers. We're working through the superintendents. We have a unique link just for them, and they send it to their staff and they get them signed up. And that way we're working through very methodically people that we know already are eligible. They still have to prove eligibility when they show up at the clinic, but we know ahead of time that they're eligible, and that reduces the chances that we would have to send somebody away.
Mm-hmm. And I'd also like to add just to those watching that this is why our notification system has not been activated other than for a test at one point. I think we have over 11,000 people signed up on that right now, because we haven't had something where we could just put out a general public invitation to register for a clinic. But when we do, and I think that may come as soon as the comorbidities clinic, that's when we'll utilize that system.
Yeah, I'm thinking, and we still are doing some internal planning here with our team. We want to obviously make this a smooth process and be prepared with the appropriate vaccine and staffing, but we may decide to issue a public link for our clinic next Thursday at SUNY Sullivan. So part of that clinic will be second dose shots for 65 and older, but the public link would go for essential workers and people with comorbidities.
To get their first shot. Yeah.
Mhm. Yeah.
Okay.
So we're trying to open it up a little bit more. We've just been a little constricted in what we've been able to do so far, and want to make sure that we're targeting the groups that we're asked to.
How do you feel about what you're seeing in terms of community transmission?
So I'm glad you asked that question. We are watching it very closely. It has been trending down. However, the number of new cases continues to be around 20 per day average. That's a concern, because if we continue at that rate, we're going to continue to see more community-wide transmission. We want this to go away now.
Yeah.
So we want to just encourage people to continue to social distance, wear your mask, wash your hands, continue to be vigilant, because, you know, I think a lot of people are very fatigued and tired, and we're really hoping that the more people we're able to get vaccinated, the more quickly, that the sooner we'll get through this. But in the meantime, we can't let our guard down. We're back up to 149 active cases. And we do have a concern about a couple of spots in the county where there may be some transmission ongoing that are small little clusters. So, you know, most of our active cases are in the Liberty and Livingston Manor and South Fallsburg areas. That doesn't mean there's no cases in other parts of the county, and people need to continue to use the preventive measures. Also, the fact that we're back up to 10 people who are in the hospital is a concern. There's 3 in ICU. Thankfully, nobody's on a ventilator, but we have to watch that very closely, because that shows that although the people who may be testing positive tend to be, it looks like the data is showing us, tend to be in their 20s, 30s, 40s, 50s. The people who are getting really sick are 50 and older, 60, 70, 80, and 90, you know, in their 90s. So those are the people that often end up in the hospital, or they're younger in their, well, I say younger because I'm getting older, but, you know, in their 50s or 60s, and they have underlying health conditions, which puts them at much higher risk of having complications, just like it would for anything else.
Yeah. All right. Anything else you'd like to add?
Continue to call the Emergency Community Assistance Center with your questions. They're taking the overflow of phone calls for us. We do our best to try to get back to people as quickly as we can. The volume is still very, very high. We have set up an information line that people can, you know, a lot of people just don't want to listen to a recording. They want to talk to a live person. So we do have those staff members through the Office for the Aging helping us man the phones. We want to thank them. They've been such a wonderful resource, as well as you know, everybody else that's assisting our department in other ways.